your questions whenever you want. We are pleased today to bring you this presentation, and we're pleased to be joined by Camille Seabury from DataHaven, who will be giving us a high-level overview of the Community Wellbeing Index and some of the key findings, just a very minimal sampling of the key findings because the Wellbeing Index is a very large document rich with lots of information. The foundation has been supporting the Wellbeing Index in this region since it was, for the last several years, since its first edition. So after Camille gives us a high-level overview of the data, her presentation will be followed by a discussion with Will Ginsberg, the Community Foundation's president and CEO, and the Commissioner of the Department of Social Services, Commissioner Andrea Barton Reeves, who we are thrilled that has been able to join us today. I will ask them to react to the data and add some color to the data based on their experiences, and we will talk about gaps and challenges and think about how philanthropy and government can work together. As I said, please enter your questions in the Q&A at any point during the webinar. And with that, I'm going to pass it off to Camille to get us started. Camille?
Hi, everybody. So Kelly, one of the other senior research associates at DataHaven, wasn't able to make it today. She had a family emergency. So I'm going to be filling in. I'm going to try and not get in the weeds too much on any of this because, like Christina said, there's a lot of information in here, and just give kind of a really cursory overview of some of what's in the index. So we put out the 2023 Community Wellbeing Index earlier this year. This is kind of the appendix that we print at the beginning of just an overview, kind of a bird's eye view of all of the charts that are in the book. One of the first things that we do in this is a community index as a kind of a it's a bit of a data policy wonk sort of thing, but where we have a single number that we can take all of these different measures of well-being, of community resources, economic stability, and kind of boil them all down into a single number that then we can kind of use to compare how are different communities doing. And so that's something that we've done the past several iterations of the index. And that just gives us kind of a starting point to say okay, here are these resources that this community has and this community doesn't have, and kind of see how those all stack up. So another thing that we look at is just kind of straightforward demographics, demographic change. So as I'm sure people are aware, the whole country, but also the state and the region are becoming much more racially and ethnically diverse than in, just several decades ago. So we saw this across the region. We saw this within New Haven. Other towns as well, to where there's much larger shares of the population are people of color, especially in younger generations. And a lot of that shift has come just from burgeoning Latino populations. We also look at kind of a economic sort of, not quite diversity, but the kind of makeup of different neighborhoods. And so we look at kind of neighborhoods as they compare, as their income compares to the state average, and kind of break those up into income levels, and find that white residents are much more likely to live in these middle income through affluent neighborhoods, and Black and Latino residents are much, much less likely to live in those sorts of neighborhoods. This happens as well. We looked at it with children in particular, and this is part of a shift of kind of a shrinking of the number of neighborhoods that would be considered middle income throughout the state, and throughout the region, where it's really some growth in the more like high income neighborhoods, a lot of growth in the low income and poor neighborhoods throughout the region. Then we took those two things together and looked at how they kind of intersect. And so this is like a little bit more technical, so I won't get into it, but just finding that there are, if we look at lower and higher income neighborhoods, if we look at low diversity and high diversity neighborhoods, there's very little overlap of high income and high diversity. And so we end up with only 4% of residents of the region living in neighborhoods that would be considered both high income and high diversity. Family resources. So this is all from or all but the last question are from the DataHaven's Community Wellbeing Survey that we do alongside the index each time. And so I won't go into all the numbers here, but that's kind of a set of questions that we ask just to get at like what sorts of resources people have for their family, for themselves, their kind of financial security as far as like being food insecure, being housing insecure. Are you like not working and want to work, or working but not as much as you feel like you need to work? So those are all kinds of measures that we can get with the well-being survey that we wouldn't necessarily have access to from other sources. A lot of our data comes from the Census Bureau, from their surveys, but a lot of times it's missing that sort of like those more like open-ended sorts of questions, or more like kind of soft measures, I guess you could say. One of the things that we were asked about a lot in terms of COVID was housing stability. So evictions, especially foreclosures as well. But I'm sure you all know about, there were a number of moratoria on evictions, both within the state and federally. And now since those ended, the rates of evictions have gone back up. Almost, I'm not sure if they're, they've exceeded the average that we saw before the pandemic. I'm not sure cumulatively how those have stacked up, like if it's kind of the landlords and courts almost playing catch up, I'm not sure. But that's definitely is now much higher rates than it was before the pandemic. Childcare is always sparse. There's generally a shortage of licensed childcare slots, especially for infants and toddlers, so under a year and a half. Costs can be prohibitive, especially with kind of the state of the economy right now. It ends up being a major part of a lot of families' incomes. Even if you can find childcare, which is, also like shortages in in a lot of areas, or kind of a mismatch between where people need childcare and where the childcare actually is. Education, I won't go into all of these kind of the big takeaways as far as the pandemic. Chronic absenteeism has really shot way up since schools were, like, it went way up when schools were first remote for that first, year and change. But it's in a lot of places continued to be pretty high. Some districts are shifting back down, but still nowhere near as low as chronic absenteeism rates were before. SBAC scores have slipped some. Graduation rates, though, seem to be pretty steady across the board. One of the things that we always look at is kind of the trajectory of public school students from graduating high school through earning a college degree within 6 years of graduating. And so there's always this and this is, everywhere, and it like logically makes sense as well, that there would be kind of drop off with each of those steps to get from that starting point of finishing high school, graduating high school, and getting a college degree within 6 years. So that's kind of there's kind of these gaps in between those steps where organizations providing support can kind of step in and make sure, like, hey, it's great that you started college. Let's help you go straight into your second year of college. Educational attainment. So this is adults ages 25 and up. A lot of the cities have lower rates of having a college degree, higher rates of adults who don't have a high school diploma. Kind of across the board, we see, especially among Latino adults, much higher shares of the population having no high school diploma. So that's, again, an area where education-related organizations can kind of step in and help fill gaps there, and help people get, a GED or whatever alternate route. As far as like preventive health, access to healthcare, one of the major things still is just people lacking health insurance. That's especially going to become really urgent now with the shift in Medicaid re-enrollment. There's been some estimates just the past couple of weeks about how many people have been disenrolled, efforts to kind of re-enroll people, reevaluate some of that paperwork. And again, we see much higher rates of Latino adults than other adults in being without health insurance. Some of the questions that we asked in the survey were kind of these ways of getting at some of these gaps. So regardless of the reason why people, or regardless of whether people have health insurance, what are some of the difficulties that they've had with accessing healthcare, especially when places were shut down, if people were out of work, if they lost insurance because of losing a job. So we asked a few questions about had you delayed or not gotten healthcare, and those are things that we ask every time on the survey, but we specifically asked the last couple smaller waves, and the larger wave of the survey that we did in 2021 asked about COVID related reasons for not getting healthcare, and also about shifting to telehealth, which people were kind of split on about how they viewed that experience. Mortality rates. This is one of those things that Kelly can speak to much better than I can, but we did see this spike in mortality rates. So this is regardless of the cause, but we assume that COVID plays a major driving role in this based on where that 2020 spike is, and other factors that kind of come as a result of that as well, complications or just things that can be exacerbated by not being able to get to a doctor. Drug overdoses. The state puts out data on every drug overdose or like drug related death that comes through the medical examiner's office. And so this as well, we've seen go way up since the start of the pandemic, and also has been the rates for Black residents and Latino residents in particular have really risen to start to surpass those of white residents for kind of the first like sustained time. And then we ask about just kind of general neighborhood assets. So the first question on the survey that I always think is really interesting is just, are you satisfied with your area? And it's just a yes or no. And it's before people have been asked about all of these other things. It might be hardships, might be kind of positive things. Before we've asked them about anything, just, are you satisfied with where you live? And it's generally in the 80% 80 to 90% range of people saying that. So that's always a good thing to see, that like regardless of whatever else might be going on in your life, in your neighborhood, that people overall are satisfied with the places that they live. And then more government related community resources, we see again people feeling that they can influence their local government is fairly high across the board, whether that government is responsive and how they view the job done by their local police is much more kind of stratified by age, race, income isn't on here, but by income as well. And I'm gonna leave it at that. I know that that's kind of a lot that I was rushing through. There's still plenty more also in the books, which are online on our website.
Camille, if I can, I'm going to put you on the spot for
Okay,
a few
great.
questions. Since you're more steeped in this than we are, and it is a lot of information, I'm wondering if you could share what you think, is there something in all this data that you felt was really interesting or intriguing, and or something that you think is really an optimistic piece of data? I know there's a lot to choose from.
Yeah. I do always like that stat of just being satisfied with your area, because I think it points to some of the, the ways that like setting aside anything that could be happening where you live, that most people are satisfied with with their neighborhood, with their town. And so I think that that points to kind of other resources that communities might have that families can kind of build a life around, rely on, that might not show up just from looking at like income level or educational attainment, that there are like other strengths as well.
Great, thank you. And there is a question about data in the Q&A, so I'll take the time now to ask you that question. Do you track the number of students who enter the trades after high school and the military versus college?
I don't think we have anything on that. So the data that we use here comes from the State Department of Education, and they actually, I think, kind of outsource that analysis to, I think they do it with the National Student Clearinghouse, which has a way of tracking high school graduates throughout the country. So I don't think that they have that. I think that they're much more just focused on kind of higher education.
Great. Thank you. And before we move on with Will and the commissioner, I do want to share, someone's asking if these slides will be made available to participants. The webinar is being recorded and the slides will be available. I see Matt has put in the chat the link to the full report, which you could see on our website or DataHaven's website. You can download the report if you want. There's lots of interesting information in there. I encourage people to really look at it. And as follow-up to this webinar, as we do with all our webinars, there will be a follow-up email that goes out that gives a summary of kind of what we talked about and what the questions were, with links to the report and other relevant resources. So everyone could be on the lookout for that. So thank you, Camille. Now I'm going to shift over to Andrea, Barton Reeves, and Will Ginsberg, but Camille, don't go too far away because people still might have questions about the data as we go through this.
All right, I'll be here.
Thank you. So Commissioner Reeves, DSS, it is the state agency responsible for administering a wide array of programs. I was looking at the list this morning and it's quite an overwhelming job you have, I imagine. But those programs include programs for food security, economic aid, healthcare access, and many other programs that promote the social well-being and provide what we all think of as the social safety net. And just generally speaking, what is your reaction to the data in general? We can get into some of the specifics as we talk more, but are there things here that you're surprised by, or that maybe delight you, or especially disappoint you? And how is this kind of information constructive to DSS? And just for the sake of the audience, this kind of information is actually available across the state. Many different regions do these regional well-being indexes with DataHaven.
Thank you for having me. I appreciate the opportunity to be here. I would say that most of the data that was presented today is not surprising. We've known that for quite some time. What most people don't know is close to 1/3 of the residents of the state, so that's about 1.2 million people, receive some sort of benefit or support from the Department of Social Services, whether it's through SNAP or Medicaid, which is where most of our members are, temporary family assistance. As you mentioned, there's a very long list of things that we do, and so that affects a lot of people. What I really found pleasantly surprising is that people are really quite pleased to live where they live. For the most part, they appreciate their neighborhoods, and neighborhoods are incredibly important. They provide this sense of community and safety and support. Part of our goal at DSS is to be able to provide people with the best quality of life that they can have in the communities that they live in. So there are some of the earlier slides, we saw those significant disparities between where people live and sort of the lack of racial and ethnic diversity in those communities. And that can be very challenging because in many ways, we know that the access to care, to good education, to strong transportation, to healthy food, especially in our states and other states that are similar to it, though many of those are linked to the zip code in which you live and the neighborhood within the zip code in which you live. And that disparity has a significant effect on many populations, but then this is my particular soft spot, so to speak, for children. So, if children live, I'm primarily in Hartford, so if children live in, 16105, which is really the downtown and the surrounding area, but then there are children who are growing up in Greenwich and Stamford in more affluent parts of our state, and they're having a very different experience. So you have a 6-year-old who's having a different living, educational, health experience in some parts of the state than other children that live in other parts of the state who are the same age. And it's those disparities that we see the most at DSS and really try to work the hardest to try to close that gap or at least meet those families where they are. Because families, they deserve to choose to live where they want to. And that doesn't mean that you should give up or sacrifice or somehow compromise the quality of life that you want for yourself and your children and your extended family because of where you live.
Thank you. And that statistic which you shared with us on preparing for this webinar is shocking, that 1/3 of all residents are receiving some sort of service from DSS. I think it's very telling. Will, a similar question for you, or the same question for you, was there anything here that surprised you or delighted you or especially disappointed and frustrated you? And how do you think this kind of information is constructive to the foundation?
Well, let me take this. Thank you, Christina. Thank you, Camille. Thank you in particular, Commissioner Reeves, for joining us today. We really appreciate your time. You're at the heart of so many of you and your agency are at the heart of so many of these issues. I'll take the last question first. I think this report, and I am proud of our long history of supporting DataHaven at the Community Foundation. By disaggregating the data, it serves this work really has an invaluable role in our state and in our community and our region. I saw news reporting last week from U.S. News and World Report that ranked the states and Connecticut ranked at or near the top in almost every measure of being a place to live compared to the other 49 states. It's only when you disaggregate the data that the disparities that the commissioner was just describing, that DataHaven's report describes, that we all know and live with every day. It's only when you disaggregate the data that becomes clear. So the importance of this kind of a report that goes deeper than the census data, and that goes to how people feel about how they live, not just the demographic and statistical data. And that's the value of the survey. So I do want to say, from our standpoint at the Community Foundation, this is extremely valuable, and I hope people will take this report to account. From my perspective, the Community Wellbeing Index is really a call to action. It's a call to action for anyone who's committed to a more equitable Connecticut, because it lays out the challenge. In terms of what surprised me, I do think, I guess I knew this because I'm kind of a data wonk myself, but when you look at the data, and it's on one of the other slides that we looked at, that compares the diversity of Connecticut and Greater New Haven and the city of New Haven from 1980 to 2020, it's truly remarkable. And it really puts the lie to the idea that we are the land of steady habits. I think our steady habit is that we continue to call ourselves the land of steady habits, because we are a vastly different people than we were a generation ago. And again, look at those bar charts. They're quite amazing. And it's most dramatic with the Latino population, but the Connecticut was 88% white in 1980 and 63% white in 2020. That the Latino population in the state is 4 times in 2020 what it was in 1980. It's 6 times in Greater New Haven what it was in 1980, and it's 4 times in the city of New Haven what it was in 1980. I mean, these are dramatic changes. These are not subtle, slow changes over the course of a generation. So, and I am actually delighted by that too. You asked me what's surprising and what's delightful. I think the fact that this state is changing the way it is creates all sorts of opportunities for us. And we need to understand the disparities that exist. We need to understand how COVID has worsened them, and we need to learn from this and see this as a transformative moment, because we are in the shadow of the pandemic, to borrow a phrase that's the title of this webinar. The last point I guess I would make goes to the how divided and segregated we are, notwithstanding these changes. And this is the point that the commissioner was making too. And that slide that says only 4% of the population in our region lives in a community that is both high diversity and high income is terrible. Whether it's shocking or not, we all have different thresholds for being shocked, I suppose. But it is terrible. And I will underscore it by saying I actually live in one of those neighborhoods, and yet where I live is not really. It's the neighborhood is high diversity and high income, but my street isn't high diversity, and other streets that are lower income in that neighborhood are not high diversity. So actually, I think the 4% is overstated, is my point, based on my own experience in my own neighborhood. And for an organization like ours, that is not only about helping to address the needs in the community, but about building community, about building connection between people across racial lines, across ethnic lines, across neighborhood lines, across economic lines. This is, talk about a call to action. This kind of data is an enormous call to action, because what it says is we are lots of different communities, but the challenge of making us one community that can truly address its challenges and seize its opportunities together, we have a lot of work to do.
Yes. Commissioner, do you want to respond to Will's comments or build on what he said before I ask another question?
I'd actually like to do both, and then just go back a little bit to the first question that you asked me, and sort of this, what people sometimes perceive to be this staggering statistic about the number of people who receive supports and services from DSS. there are a number of misconceptions that I think I'd like to clear up, at least one in particular, about the people who receive supports and services, because we hear this a lot. And I think I always understood this, probably pretty abstractly before I became the commissioner, but really understand it very concretely now. There are so many assumptions made about people who receive supports and services through DSS. And we have to tell you that the vast majority of people who receive supports are working families. They're working 2 and 3 jobs,
Right.
making anywhere from like $12, sometimes $17 an hour. Quite frankly, that's a rarity. And they may have a couple of kids, sometimes 3, just a family, and they are doing their very, very best. But still, as we've all watched the prices of energy rise and the prices of food rise and rentals, I know at one point there was discussion about housing insecurity and eviction. These are all challenges that the families that we support are facing every day. So if you are dealing with somewhat low wages, stagnant wages that cannot keep up with the cost of inflation, or just a general rise in the cost of living, you're going to need help. And what we find quite often is that there's a lot of stigmatization that occurs when we're talking about families that need help. There is absolutely no shame. There is nothing wrong. This whole concept of that people who live in poverty or people who are low income are lazy. There's so many misconceptions that I feel like we as an agency are fighting every single day. What we are fighting for is equity. We are fighting for equity, for access to quality medical care, which is what we do through Medicaid, equity to access to good and healthy food, no matter where you live, which is what we're doing with our SNAP program, and on some of the waivers that I could talk a little bit about, that we're really pushing the Centers for Medicaid and Medicare, commonly known as CMS, to say, please see the people that we all serve differently. Do not continue to apply the rules from 1964 or 68 to the way that people live in 2023. And we can see, as Will had said, how even our own state, our land of steady habits, has really changed in terms of the demographics and the people that we support. And we want to support cultural diversity, economic diversity, and make sure that families are happy wherever they are. But I also like to take every opportunity I can to say, I would really encourage people to think so differently about what working in the state and being a family in the state and being economically self-sufficient here really means, and to understand that in the context of the person who might be sitting next to you, who's going to school with your kid, who's working, who's delivering things to your house. All of those people are residents in the state and deserve to be treated with dignity. And that's one of the things that we're really trying to get across here at DSS.
I think that's a great point, Commissioner. And, you look at unemployment, your point about working people, during the depths of COVID, unemployment was, I forget what it was in Connecticut, but, nationally it hit close to, there were 40 million people unemployed or something. Today, unemployment is low. It's very low. It's historically low, but that doesn't translate to prosperity for everybody. It doesn't translate to being able to make a life, as you say. So I think again, it goes to A, disaggregating the data so we really understand what's going on, and B, doing the kind of surveys that DataHaven does so we understand how people are living, not just whether they're employed or unemployed as a statistical matter.
And you said, Commissioner, that you're fighting for equity. And in fact, at the foundation, we're fighting for the same thing. And the centerpiece of our current strategic plan is opportunity and equity. So I wonder, Will, if you want to take a few minutes to talk about how the foundation has responded to all of this under the heading of opportunity and equity.
Well, I'm happy to, and thank you, Christina, for that. And I start by saying that COVID, actually our opportunity and equity strategic plan predates COVID. And a lot of this data that DataHaven is sharing with us predates COVID too. But COVID underscored the importance of opportunity and equity as our strategic priorities. And, one of the things I've taken to saying is that COVID was an enormous test, has been, I shouldn't talk about it completely in the past tense, has been an enormous test for our society. And I think on the equity point, we failed the test. We failed, our health inequity got worse, educational inequity got worse, economic inequity got worse. In my view, and I'm sure not everybody agrees with this characterization, but in my view, we failed the equity test as a society. And I don't just mean in Greater New Haven or in Connecticut, I mean as a country and as a society. So, you know, I start with, have we taken that, what I regard as a truth, to heart? And are we committed to seeing this as a transformative moment where we have to do things differently, and where we view the way we were addressing equity, racial equity, and equity in other ways, historically, the progress we were making ultimately has proven not to be adequate when faced with the test. That's certainly the way we look at it at the Community Foundation. So we have, over the last 3 years, stepped forward, and I'll tell you why I use that term in a moment, to do more and to do things differently in light of this. We call our COVID response initiative Stepping Forward. We did something that we have never done before, and very few, if any, other community foundations around the country did, which was a large-scale, broad supplemental extraction from our endowments, so that we had significantly more discretionary resources at our disposal. And we've done a lot more grant making through all our different grant making programs, which Christina runs as a result. We're also doing things differently. We're focusing on the opportunity side. We're focusing on inclusive growth. We have gotten state and city support to create something called the New Haven Equitable Entrepreneurial Ecosystem to support small business. These are for-profit businesses. Our traditional work is supporting nonprofits, for-profit businesses, particularly run by people of color and run and owned by people of color and by women. We have focused on leadership, that the leadership of the community, we need to build a more diverse leadership in this community for the next generation. That's how ultimately we will build a more equitable community. So in a whole bunch of different ways, whether we're talking about leaders in the nonprofit sector, leaders in small business, we're focusing on supporting future leaders in this community. We've created a Black Futures Fund, focusing on a new narrative, a narrative of Black excellence and achievement that breaks out of viewing people of color as recipients of philanthropy, but rather as people who shape the community. And that's a big part of it. And Christina's work is increasingly building a different kind of relationship with local nonprofits, giving local nonprofits more latitude to use our grant resources and putting decisions in the hands of others. So these are all things we've done, not only to do more, but to do things differently in response to what we see as that this can be a transformative moment around equity if we understand the need for it to be, and if we all act together to make it so.
Thank you, Will.
I'm so heartened to hear all the things that the foundation has really focused on. And so for the sake of our audience, I actually approached the foundation and asked if they wouldn't mind playing a different role with state government than it had before, which is to really act as more of a partner and a convener, because we wanted to be much more open around hearing what the challenges are that are happening across the state, because we can't be everywhere, but we know that our philanthropic partners are. And I know, Christina, you'd asked me earlier what my 3 priorities are, and I had jokingly said they change from day to day, and it depends on what your email list looks like. And sometimes that's true, but for the time that I'm here, I actually have 3 primary focuses, and they tend to align or dovetail in some way. So Will has identified. And one of them, and we've heard this very clearly, is Medicaid payment reform. So we're really starting with engaging in a comprehensive rate study over the next 2 years, because we know and understand that the reimbursement rates that providers have received, the nonprofit partners have received, is not adequate for them to do the quality and the quantity of work that they need in order to support the communities that we all want to see thrive. So that's number 1. Number 2 is improving, this is more internal for us, is really improving the customer service experience, because part of the indignity that people have been experiencing has been getting on the phone and being on there for hours and hours and waiting to talk to someone when you're trying to feed your family and get access to care. And that's just not anything that we want anybody to continue to experience. So I have really been charged by the governor and have a personal pledge to really improve that experience, because not only is it sort of an operational change, but it really is sort of a psychological and psychic change to know that when you call to get help, that you're being treated with dignity and respect. And part of that respect is someone answers the phone when you call. It's, you know, so that's part of what we're working on in terms of this overall cultural change about in the ways in which DSS supports communities and interacts with communities. And then to your point, Will, about changing relationships and really seeing that, you know, your funders and your donor partners and also the organizations that you support, to see them as being more collaborative and having a different vision. We're actually doing the same thing here, and that really is sort of changing from our more hierarchical approach that, you know, we kind of know everything, to working toward a much more collaborative process with our partners. So we're meeting with our federally qualified health centers and our hospitals and our community. We just were able to get legislation passed with a number of really important partners to get community healthcare workers at least to the table, so we can have discussions with them about how they can be a part of the care delivery model that we've had for quite some time. We're also really pushing, as I said before, the Centers for Medicare and Medicaid to say, we know that you've only funded certain types of work before, but we also know that other states have asked you if they could fund different kinds of work. For example, those who are justice involved. If you are currently incarcerated, you are ineligible to receive any supports or services through Medicaid. Well, we know that the folks will eventually be returning to communities, many of the communities that we support, and we want you to be able to have some sort of a self-sufficiency so that you can continue on the path that does not lead to recidivism, because that's good for all of our communities. And so we're starting to have those conversations as well. So I'm just really thrilled to be here, to be able to share some of the things that we're doing and to see where there's more synergy and collaboration, because we are very excited to be working with our community foundation partners so that we can try to do our work in some ways differently and in many ways better.
So I want to stick on the topic actually of health access, and you mentioned Medicaid, and hopefully maybe get to some housing topics. But, you know, I'm curious, you talked about the Medicaid rate, but I'm curious to know, with the end of the public health emergency, if people don't know, during the pandemic, many more people actually became eligible for Medicaid. And now that was under a public health emergency. And Commissioner, you'll tell me if I get any of these facts wrong. And now that the public health emergency has ended, people have to kind of reapply or get reapproved for Medicaid. And many of the people who got benefits during the pandemic will probably lose those benefits. Many people that never qualified for Medicaid before will actually probably now qualify for Medicaid because of the change in their life circumstances. So I'm curious to know how your office is handling that significant shift in Medicaid and what I imagine may be an operational nightmare to manage all of that transition. So I'm wondering if you could say a few words about that and what the impact is on individual people in terms of the end of the public health emergency.
Sure. Well, first, I'm very happy to share that it has not been an operational nightmare at all.
Oh, that's
And
good.
I'm really thrilled and actually quite proud to say that. And I do want to give full credit to the team that was here, you know, obviously prior to my arrival, particularly to was now Deputy Commissioner Peter Hadler and Lorianne Wagner and Sharon Condell. There are a number of people who have worked here long before I arrived that made sure that they used every tool available and flipped every lever to make sure that it would not be a nightmare. And in fact, it hasn't been. So we spent a lot of time executing a campaign called Update Us So We Can Update You, so we could reach as many people as possible for them to update their contact information and to let them know that the public health emergency was unwinding and they may be impacted by that unwinding. And that has actually been extremely effective. We've also been able to use a lot of text messaging to get in touch with people, because our population that we serve tends to be fairly transient, but they do tend to keep the same cell phone number. So that's been a great way of meeting them. But what's happened, we're finding, is that because the unemployment rate has dropped, there are people who are now over income and they are falling off of Medicaid eligibility because they're making more money than they can make in order to remain Medicaid eligible. There are also a number of folks that we are looking for who have not responded to the Update Us So We Can Update You campaign. So we are, determining, because we get a lot of returned mail, where they might actually be so that we can figure out where they are. And then there are some that, because they're called what we call above asset, they've actually moved into what is, they've either moved on to another plan on our health access exchange, or they've moved into a program called Covered CT or Covered Connecticut, which is for people who make too much to qualify for Medicaid, but not quite enough to be able to participate, let's say, in an employer's plan if they're eligible for that. So we have a number of people that fall into those categories. Medicaid, by its very nature, is a program where people come in and out all the time. Their circumstances change, but we've really been trying to give people a lot of support. So fortunately, Christina, has not been nightmarish at all. So we're really pleased by that. We just want to make sure that we are doing our best to keep track of the people who have been disenrolled for all of the reasons that you identified, and that we can make sure that they've landed somewhere if that's their choice to do so.
Great. That's great to hear. And you actually mentioned this issue around collaboration and coordination, and we actually have a question in the Q&A that kind of gets to this. And the question is, how can we coordinate the strategic priorities of departments like DSS with DOH, DDS, and others to focus on building stronger communities? Housing is critical, but yet many of the resources provided to the homeless response system require placing people in communities not of choice, but of perceived affordability. And I say that in the context, I was reading this morning that when you were appointed to your position, your predecessor, it sounds like, was appointed to a different position, overseeing a department with the goal actually of better integration and collaboration around these kinds of issues. So I wonder if you could say more about that.
Sure, I'm happy to. So there is, it is a somewhat informal cabinet, but there is a Health and Human Services cabinet that consists of many of the departments that you mentioned, including the Department of Public Health, Housing, Aging. I know I'll miss someone, the Department of Developmental Services and the Department of Social Services. And those commissioners meet on a regular basis. Usually we meet every week or usually every other week. And we're discussing these overarching issues that affect everyone's agencies. But the question that was raised is a really interesting one, because while we're meeting and talking about the priorities that go across our agencies, it would be, I think, probably quite helpful to us to understand what it is that our community partners are also experiencing, because that can be a challenge for them as well. We even find it internally. Well, I'll use nursing homes as an example. So we may be having a conversation here at DSS about nursing homes and funding and accountability and quality of care. And so might the Department of Public Health as the licensor of public. So we're the funder, they're the licensor. And so now we're having more conversations together about how do we collaborate so that funding and licensing are not necessarily disparate paths that we follow, but they're more coordinated so that we can help the industry and those within the industry who want to provide even better care to be able to do that, and to hold those who are not, quite frankly, more accountable. So I do think there's space for improvement there, and I'd be happy to hear about ways that providers think that we could have more of a dialogue around that.
And continuing along the theme of collaboration, because we only have 10 minutes left and I have a bunch of questions we won't get to, but how do the two of you see opportunities for philanthropy and government to work together? Traditionally, philanthropy has been seen as a place for potential innovation, but as of late, I think we see ourselves, especially during the pandemic, and really having to fill gaps, sometimes gaps that the state can't get to. So moving forward, I think, what's your vision or ideas about how philanthropy and government, where are the opportunities for philanthropy and government to work together? And I'll start with you, Will.
Well, thank you. And I'll start with an apology for having disappeared. My computer chose a most inopportune moment to decide it was time to restart. That's a whole other issue. I would say this. I think there is enormous room for more collaboration between philanthropy and government at the local level, government at the state level, and even government at the national level, although that's quite different. I think to much too great a degree, the focus is on funding. We're both funders, and frankly, philanthropy complains that we don't get the kind of collaboration with government that we want, but philanthropy is scared because how often do we hear people in philanthropy say, we don't have enough resources to fill these gaps, and that's what government is looking for. I actually don't believe that's the issue. I don't believe our collaboration should be based fundamentally on funding. And I think what philanthropy has to bring to the table, one of the important things philanthropy has to bring to table to government, to people in positions like yours, Commissioner Reeves, is independence. Public agencies, we have independence. We have resources. We're not dependent on short funding sources in the immediate term, endowed institutions like ours. We have a level of independence that regulated entities don't have, that government agencies don't have, and independence from politics and all the pressures that brings. So I think to some degree that does relate to the innovation point, Christina, that you were making. But I think that we can bring that to bear with knowledge that we develop that challenges the status quo, that challenges the way things are done currently, that bring fresh perspectives and independent perspectives to the table in a way that is very difficult for government to do. And I think we don't think of it this way very often, but I think that can be a starting point for a lot of productive collaboration between government agencies and philanthropic institutions.
And what about you, Commissioner? I know you came to us and you're very interested in engaging not just government talking to government, but really engaging in community more and us figuring out how philanthropy can help. But what opportunities do you see for partnership between philanthropy and government? And do you agree with what Will said?
I agree wholeheartedly with what Will said. I do think there's plenty of space for innovation. And as he was talking, I was thinking about what had happened in the very beginning of the pandemic and how Governor Lamont reached out to his philanthropic partners, right, the Dalio Foundation in particular, to say there is this immediate need. We need laptops, we need Wi-Fi. There are things that we need to see where the philanthropic community would be willing to step up and step in and partner with government to meet these needs so that children could continue to engage and get their educations. I think that was a perfect example of ways in which there are private-public partnerships that can work quite well to meet a specific need. I agree with that perspective. And I also, as I started at the beginning, feel that our community foundations and other philanthropists, philanthropic organizations can help us reach spaces in the communities that we just can't get to. And you're hearing voices that are different than the voices that we are hearing. So I was so very interested in knowing, well, what is happening in New Haven? What's happening in Bridgeport? What's happening? I'm in the Hartford area, but I don't know what's happening in the quieter corners of our state. And physically, I could never get to all 169 towns, right, and cities and hamlets and villages in our state. But I know that our foundations do hear from those community partners, and they know. So where there are instances where you're hearing that there's need and may not fit, and let's say, for example, it might not necessarily fit into your mission, or your donors might not necessarily have an interest, that is something that we would be interested in hearing, because if we hear it from enough places, that might be an opportunity for us to pursue something with respect to policy with legislators, ask to have a conversation with CMS again to say, hey, this is what we're hearing, in 9 different cities and towns in our state. Would you be willing to engage in a conversation around what we can do at DSS? And it also might be an opportunity, to Will's point, and I think also earlier, Christina, to your point, to figure out where other state agencies might partner, because they may not be hearing exactly what we're hearing. And we said, there's a housing issue and there's also a healthcare issue in this particular town, or village that no one's talking about. And is there something that we can do to help? That's where I see the partnership is. That's why I came and said, can you help us to have a broader reach? Because we really want to hear what's going on. And we want to have the collaboration and partnership that we know that only community foundations and philanthropists have, that we don't.
Yeah, and just I couldn't agree more, Commissioner, with what you just said. And just to underscore the point, and I've spent some of my life in public sector positions, and you mentioned 169 towns, that sense of accountability to everyone that the governor has and the commissioner of social services has and state government has in general. It is sometimes feels like a burden, but it is actually a privilege in private philanthropy to be able to choose, to be able to, it's not easy necessarily, but to be able to choose and say, we're going to focus here because for whatever reason. And again, that's part of the independence that I was referring to before that we can bring to the equation.
Yes, thank you both. I think we have a few minutes left, and I want to try to touch quickly on another topic, which is housing stability and evictions. And I'm not sure, Commissioner Reeves, how much of this you could speak to, but I think of note is we've heard from New Haven legal assistants, Alexis Smith, who's the executive director there on many occasions. She's given me quite an education on this topic, as has Kellyanne Day from New Haven Home Recovery, but our New Reach is that Connecticut had such a terrible eviction rate, maybe one of the highest in the country, if not the highest in the country before the pandemic. And then during the pandemic, there was all these moratoriums on eviction, and now those are gone. And now to hear from Camille that those evictions are at a higher level than pre-pandemic, when we were doing so poorly pre-pandemic. So I don't know, Commissioner, if you could speak very briefly about anything that's being done to address that, or anything you know about that piece of information. Housing is something we're talking about a lot in the philanthropic space.
Talking about it a lot here because Medicaid traditionally has not allowed for specific funding to be addressed toward housing, but for all of the reasons that you cited, again, these are conversations that we're having with CMS to say, we know this isn't something that you usually do, but our state is really in a state of crisis around a lack of affordable housing and the eviction rate. And we see this happening all around us. There are lots of reasons why it occurs, who owns the property, the rise in market rates, all kinds of reasons why evictions are happening at the rate in which they are. And the impact that it has on homelessness, I think is truly immeasurable. And the impact that it has on families is as well. But we recognize that. And so what I can say right now is while we because of our mission and because of where our funding comes from, we are somewhat limited as to what we can do. We've raised the issue with our federal funder to say, let us talk with us about other things that you think that we can do, that maybe we can partner with the Department of Public Health or the Department of Housing so that maybe they can get the funding and we can provide the support, but those conversations are definitely happening.
If I have one moment to just add, coming out of this historic pandemic, one of the things I've learned that has really stuck with me over the years is this idea of social determinants of health. And our current board chair, Dr. Marcela Nunez Smith, is a national expert on these subjects, which has been part of my learning. But that a third of one's health outcomes are determined by the healthcare you get, a third by your genetic makeup, and a third by the social conditions under which you lived, diet, housing, et cetera. So. And we live in a society where spending on healthcare goes up and up and up, and spending on so many of these social services, including housing, does not. So if we can get the health, to your point, Commissioner, about CMS, if we can get the healthcare apparatus to understand the social determinants of health and incorporate that, and of course, many people all across the spectrum work on that every day. But if we can make that happen in a meaningful way, that is one way we can address this issue. One way we need to address this issue.
Right. Well, we're running up against time, and Carmen will fire me if we go over time. But thank you, Camille and Will and Commissioner, for joining us today. This was an excellent conversation. I think it's just scratches the surface And Commissioner, I'm really pleased with your offer to engage with us more in partnership and reaching into community. And I know the wheels are turning on all my staff about how we can make that happen. So look forward to additional invitations to join us. And thank you so much for being here today. There are a few more questions in the chat about the availability of reports, but Matt and/or Carmen have put information in the chat to address those questions. Everyone will receive an automatic evaluation when the webinar ends. I strongly encourage you to fill out that evaluation. It's really important to us. We will share the results with the commissioner and her staff, and with Will. Everyone will see the results, which will also be constructive to us as we plan future donor briefings. So again, thank you all so much for taking the time to be with us today. And I hope everyone enjoys the rest of their afternoon.
Thank you, Commissioner, very much.
Thank
Appreciate being
Thank
with
you
you
so
and look
much for
forward
having me.
to other
I'm
opportunities.
really grateful. Thank you so much. Have a great afternoon, everyone.
Thank you.
Bye.